My name is Laura Obici. I'm an internist and I've been working at this Amyloidosis Research and Treatment Center for more than 20 years now. Our center is the largest center devoted to the diagnosis and care of patients with systemic amyloidosis in Italy. And we provide all the diagnostic workup for this disease, as well as the up-to-date treatment opportunities for patients with systemic amyloidosis, as well as many research activities investigating the clinical aspects and also basic research in the field of systemic amyloidosis. This center was created by Professor Giampaolo Merlini, who is our mentor, who decided to create a center because of the absolute need for a center for this disease in the country, in the absence of any experience across all the different regions. So he set up these centers in the 80s, and then the center progressively increased in its capabilities and in expertise, becoming a multidisciplinary center. Now the center is directed by Professor Giovanni Palladini. He has continued on the tradition of Professor Merlini, and we have all collaborated to implement this center. We have been able to have a dedicated area of the hospital, thanks also to donation from patients. Our center deals with all the different systemic forms of amyloidosis, so the patient's population is quite heterogeneous. Typically, systemic amyloidosis are diseases that affect adults, particularly for some forms like wild-type transthyretin amyloidosis, aged people, but we also deal with some hereditary conditions that may affect people earlier in their lifespan. So we see also patients in their fourth or fifth decade of life. We see predominantly patients from across Italy because this is the historical center for systemic amyloidosis in the country. And for many years, we've been the only one available. So patients have been referred to us by many local hospitals across the country. Now there is an increasing number of centers dedicated to amyloidosis in our country, so many patients can remain treated locally. Sometimes they just come for consultations, but their main referral remains the local center. We also have a lot of patients coming from our region, of course. There are many specialists working in our center, including cardiologists, neurologists, psychologists, and nutritionists. And the flow of the patients includes a first evaluation, which is performed by an expert physician that could be an internist or a hematologist or the cardiologist, depending on the main clinical presentation and needs of the patient. And then on the same day, the patient may undergo different evaluations in order to completely assess the disease stage and to be able then to discuss the potential treatment options. For patients with a suspected or confirmed hereditary disease, we also have a genetic counselor available to deal with all the genetic aspects related to the disease. We also have a part of the center devoted to clinical trials. So sometimes patients are eligible for clinical trials and they, in that case, enter a different pathway in which they are taken care by a different physician that monitor and includes the patients in the trial. We have meetings among the different specialists that take care of the different patients in our centers. Sometimes we also have multidisciplinary evaluation at the same time. That means that the patient is simultaneously seen by the internist and the neurologist or the internist and the cardiologist. Similarly for the genetic counselor that sometimes may have the physicians responsible for hereditary systemic amyloidosis participating in the visit. So we have some shared activities as well as multidisciplinary meeting in which we discuss what has emerged for a specific patient, which are the best therapeutic options, and how to establish a follow-up.
Some of the specialists work directly here in the center, so it's easy to communicate with them. And we can also organize specific meeting regarding specific case in order to discuss on a case-based approach what we need to do with that specific patient. And then also we can have online meeting, thanks to some new technology that the hospital has provided us. So we can talk about the patient and share files about the patient in a secure way. So that's helping in communicating among the specialists. Another thing that's recent in our center is that now we can collect all the information of the patient just in one spot online or here inside the center. So every specialist can have a look of the journey of the patient basically instantly, because everyone is writing their reports in this site, and everyone can have a feeling of what the patient is doing and how it's progressing or how it's responding.
Our center offers all the updated techniques and tools that are needed for optimal diagnosis of systemic amyloidosis, which is key for effective treatment. So we provide laboratory investigations, particularly hematological investigations, to confirm, stage or rule out AL amyloidosis, but we also perform genetic analysis, offering genetic tests for all the different systemic forms of hereditary amyloidosis and also autoinflammatory diseases. And importantly, we provide investigation of the tissues for typing of amyloid deposits, both by mass spectrometry and by immunoelectron microscopy.
When a patient comes for the first time at our center, he has to do a complete evaluation. He has to do echo and ECG for looking for cardiac involvement. He has to do a general visit, usually with an hematologist or an internal medicine that's looking more about the hematologic side of the disease. They do blood samples in order to have all the information that we need. And if needed, they do the fat aspirate in order to have the biopsy and the typization of the disease if needed. And usually they do also some physical evaluation, like the 6-minute walking test, because we need to have information about how they perform on a normal day life. And they also complete some questionnaire that can help us identify their quality of life and try to understand how the disease has impacted their life. And then according to their history, to their medical history, we plan if they have to do bone scintigraphy or MRI, cardiac MRI, or if they need to do other specific evaluation in order to give them the opportunity to have a complete evaluation. For example, patients that come with the mutation of the TTR, they need to do a neurologic evaluation. So they come, then they see the neurologist, they do the visit and the electromyography as well. And sometimes if they have gastrointestinal problems, they'll have to have a talk with the gastrointestinal doctor as well. So it kind of depends on what's their specific problems. So hopefully we come out with the answer that tells the patient, you have this disease affecting this type of organ, and this is the therapy we suggest.
Our center offers all the different therapeutic options that are presently approved for the different systemic form of amyloidosis, and also many investigational approaches. Of course, these depend on the type of amyloidosis the patient is suffering from. For transthyretin amyloidosis and in its wild type form, we have a TTR stabilizer. For patients with hereditary TTR amyloidosis, we can offer either a TTR stabilizer or a gene silencing agents, whereas for patients with light chain amyloidosis, we can offer autologous stem cell transplantation or other drugs that are directed against the plasma cell clone.
Our research activity is based on two aspects. One is clinical research activity. We have all different clinical trials available for the different systemic amyloidosis. So, For light chain amyloidosis, we have both phase 3 and phase 2, and we are about to start a phase 1 clinical study. So for the treatment of newly diagnosed and previously treated AL amyloidosis patients. And also for a TTR patient, we have both phase 3 and also other phase clinical trials. So clinical research is fundamental, not only clinical trials, but also retrospective clinical research. We have many studies that are conducting on our biorepository biobank on biomarkers. Most of our research in the past was based on the role of biomarkers for diagnosis and prognosis in the different systemic amyloidosis. The second important part of our research is laboratory research. Our laboratory research is also divided in two parts. One part based on the evaluation of the clone for light chain amyloidosis, mainly focus on the sequence of the light chain, characteristics of the light chains, and prediction of the amyloidogenicity of the light chains. And the second part is the mass spectrometry application for the evaluation of amyloid deposit. This is another important issue of research because we are doing mass spectrometry for diagnosis, but also we are working on research using mass spectrometry.
So we are participating in Italian networks and international networks of collaboration. In Italy, our center has promoting the Italian Society of Amyloidosis, which is a network of more than 60 centers that are devoted to this disease. We also have other collaboration, for example, a newborn Italian network of cardiologists devoted to systemic amyloidosis. At the international level, we collaborate with other centers in the International Society of Amyloidosis. We perform specific research program with some centers in Europe, and we also are part of the European Reference Network for Rare Diseases, in which amyloidosis centers have a major role. Within the Italian Society for Amyloidosis, we promote events to spread knowledge about the disease across different hospitals or other newborn centers. This is a major engagement in which we are happy to take part. We also collaborate with two associations of patients in our country. They promote events to which we participate as well. And I think this is an extremely important part of our duties to contribute to spread the knowledge of the disease across the country. There are still several challenges for continuing to perform in this field, offering the best to our patient. One important part is recruitment of personnel to the center, because we are continuously increasing in terms of activities. So it's important to be able to increase the number of people working at the centers and to motivate them to work in this context. So raising money for research activities and also for human resources at the center, this is a major challenge. Of course, we have to perform research and publish. Our hospital is also an Italian scientific research hospital, so it's important that we perform research. So sometimes it's not very easy to combine the two activities, the clinical activities and the research activities as well. So this is another important aspect. And again, raising new collaborations, finding new partners for important research activities. I think one important is to find inside the hospital colleagues that might be interested to work with you in this field, to engage them in patients' discussions, to raise their interest and to motivate them to collaborate together. And I think once you have established a minimum number of expertise inside, then the quality of care improves and all people are more motivated to remain in this field. The other issue is to have a facility in which you can perform all these activities, which is dedicated to it, which is quite helpful to promote also multidisciplinary team discussion and to have time for the patients for each visit. So having enough space for a center is a major issue, and I think you have to deal with the hospital management in order to receive such a facility. That is extremely important. Our center is including into many different networks that act at the regional, at the national, and the international level. This is extremely important. For example, for prescribing some high-cost drugs, you must be recognized by the regional authority as a good center that is able to provide accurate diagnosis and care for the patients in order to be able to prescribe the drug. So this is extremely important. At the same time, we have some obligation at the national level, for example, including in a national registry all our patients in order to provide figures on the number of the patients affected by this disease, which is important to inform policies about the disease itself. And then at the international levels, being part of this European reference network, this has the opportunity to discuss with international experts most challenging cases. So we participate in a platform in which we can discuss these difficult cases with experts from our countries and provide our own expertise to patients that are seen in countries in Europe in which this expertise is not available.
To be able to work inside the center as a specialist, I think it's important. So I would suggest that to the new center that are growing around the world. It's helpful to be in the same place because that's facilitate the communication among the specialists. So that's one important thing. And also to identify one or two specialists that's taking care of that disease so they can learn as their experience grow. And I think that's also very helpful because we learn every day by collaborating with the other specialists and by seeing our patient. So I think that's another important thing. And if you're thinking of building a new center, I think it's important to have a laboratory and a pathologist that can help you reach the correct diagnosis because that's a game changer for our patient.
The aspect that I would like to suggest is really to make the multidisciplinary approach that we discussed, and also to be aware of our own limit. I'm really aware of my limits. I know that I need advice in order to face maybe other diseases or other rare diseases. So be aware that patients with amyloidosis is really a challenge because it sometimes have also other issue or needs the support of other specialists. So really, I really think that the main point is to discuss between each other, discuss with experts, sometimes ask the advice of other experts, and really collaborate between each other, maybe also across countries. We have a great collaboration also across other institutions or other referral centers across Europe, and not only across Europe, in order to get the final diagnosis, in order to get advice in specific situations. So really, I think that in order to set up a referral center, in order to set up for amyloidosis, the key point is to collaborate between each other, collaborate with experts that are well-established excellent centers, but also collaborate between each other in order to have the opportunity to see the different challenge in the treatment of amyloidosis.
Working at an expert center for a rare disease, I personally think it's a major opportunity because it allows you to create your own experience, building on other people's expertise, discussing with them, and having everyday new ideas on where to move on research in this field. So I think it's extremely rewarding for any people who is interested in really providing excellent care to his or her patients. And it's also a wonderful opportunity to work in team and to generate collaboration international. I think this is a very hot topic worldwide and provides a lot of opportunities to anyone who is interested in it and wants to know more and also contribute to discover more on this. Some recommendations that I would like to provide to those that would like to implement or create a center for amyloidosis are certainly to look for collaborations, to visit our other centers, to have visitors from other centers, because I think this continuous discussion is extremely important to build experience and to have more knowledge and different perspective on the disease, and this is extremely important. And the other thing is to look for money, because also money is extremely important to have research activities, to have more people recruited and collaborate. So any possible source of funding should be explored.